All right, good morning, everybody. Welcome to Pediatric Grand Rounds. Today, it's my pleasure to introduce Dr. Rachel Moon. Dr. Moon is a pediatrician and a SIDS researcher at the University of Virginia. She received her medical degree from Emory University and completed her pediatric residency at the Children's Hospital of Philadelphia. She is the Harrison Distinguished Teaching Professor of Pediatrics at the University of Virginia School of Medicine. Her research centers on SIDS risk factors, and how parents make decisions. She's a chair of the American Academy of Pediatrics Task Force on SIDS and an associate editor for the Journal of Pediatrics. Please join me in welcoming Dr. Rachel Moon.
Good morning, everybody. Thank you so much for inviting me to give Grand Rounds. It's such a pleasure to be here with you virtually. I hope that in Roanoke, it's as beautiful as it is here in Charlottesville this morning. So today we're going to be talking about the importance of social networks, social norms and attitudes in infant care practice decisions. I have nothing to disclose. Before I start, I'd like to acknowledge the other people with whom I work, our team members. We're a large team, and I'd particularly like to give a shout out to Timothy Heron, who is our statistician, and then Ben Cornwell, who is the sociologist who does our social network analysis. They do an amazing job at what they do, and they make all the rest of us look very, very smart. So this morning's objectives, we're going to describe the different types of social networks for mothers of young infants. I hope that you will recognize the role of social networks and social norms in parental decision-making processes, particularly with regards to infant care practice decisions. And then we're going to describe some public health interventions that use changes in attitudes or norms to positively change results. So to start with, I'm going to talk about some definitions. So what is a social network, and why are social networks important? So the social network are the people that you surround yourself with and that you communicate with day in and day out. So this is your family, your friends, and your peers. And we know that behaviors in general and parental decisions regarding infant care practices are not easily altered just because you give them scientific information, because they're not based on scientific information, these decisions and these behaviors. So the behaviors are instead very, very highly reliant on information that is often non-factual from the social network. And we can see this every single day in the news or just around us, whether it be vaccinations, whether it be COVID, whether it be anything really. So what are social norms? So social norms are the rules of a group, like a social network, that define what behaviors, attitudes, and values are appropriate. And these rules are often unwritten. So there are two different types of social norms. There are descriptive social norms, and this is what you perceive to be what is normal behavior, what everybody is doing, prevalent behavior. So this is when your teenager comes to you and says, well, Mom, everybody is doing this. Injunctive norms are what you perceive to be acceptable behavior. So you are most likely to do what you perceive to be normal and acceptable so that other people don't judge you. And as I mentioned, social norms are highly, highly influenced by your social networks. So why do we as healthcare providers care about this? We care about this because social norms and social networks may be a major barrier to acceptance of healthy infant care practices. And to improve and better target educational messaging, we have to understand norms and social networks. So social network analysis is when we analyze the characteristics of these social networks, of these naturally occurring groups that influence your behavior. So with social network analysis, we can identify who identifies whom, who influences whom, how these network members are connected to each other, and the structural features of the network that might increase or decrease the influence of the network members on each other. So this is an example of a social network. So let's say that we have a mother of a young infant, and she is right here. And then we have different circles of influence for her in her social network. So you have the strong ties, you have the weak ties, and then you have temporary ties. And you can see there are different categories of people. So family members, work friends, soccer friends, high school and college friends, book club friends, random people that you met on a cruise a few years ago, and you hung out with temporarily. And the strong ties are the people that you see much more often and you've known for much longer. And then the weaker ties are the ones that you see periodically or occasionally, and are not you're not as close to them, but you still talk to them, and you still get and you're still influenced by them. So Game of Thrones, if you're a Game of Thrones fan, you will appreciate this. Somebody did a social network. They mapped the social networks of Game of Thrones. And so you can see here, the people, the names that are the largest are the ones that have the biggest, the largest social networks. And the stronger the ties, the longer the ties have been there, the darker and the more bold and the thicker those lines are. So social network analysis can be done for a lot of things. In the Framingham study, Nicholas Christakis did social network analysis looking at the change in social networks of smokers over the years. So so the little yellow circles are smokers and the green circles are non-smokers. So you can see here in 1971, there are many, many more smokers than there are in 2000. And then the other thing that you'll see is that the smoker, so smoking and the acceptability of smoking has decreased over the past few years. And so you can see, whereas in the 1971, smokers were at the center of many of these social networks. Over here, if you see a blow up here, now the smokers are in smaller subgroups, or they're at the periphery of the social network. And so they've been ostracized a little bit for smoking. So we did social network typing of 402 mothers of young infants, and we found that there are two basic types of social networks in mothers. One is the exclusive type, and this is an example of an exclusive type. So the mother, whom we also call the ego, is the black dot in the center, and then her social network members, or what we call alters, are around her. And all of the alters here are squares, and square means relative or kin. So you can see that for this type of social network, the people that this woman surrounds herself with are all relatives. And these ties are very, very strong and dense. So she's known these people for a long time, and she talked with them often. And they all know each other very, very well. So that is an exclusive network. The expansive network looks very different. So again, you have the mother here, the ego, who is a black dot, and you can see that her alters are both circles and squares. So she has some relatives in her social network, but she also has non-relatives in her social network. And you can also see that some of these lines are very dark and black, and others are lighter and grayer. And so she has very, very strong, thick ties here, but she also has a lot of weaker ties. And some of these people know each other, and some of these people don't know each other very well. And then when we do demographic analysis of these social network types, it's very interesting because women who have exclusive networks, they're much more likely to be younger mothers who have older alters. So, their mother, their grandmother, their aunt. And these mothers tend to not be married, and they tend to be African American. So as opposed to the expansive networks, these women are more likely to be older mothers, and their alters tend to be the same age as them. So, contemporaries. These mothers also tend to be married. They tend to have higher educational status and socioeconomic status, and they're more likely to be white. So I do want to mention that weak ties are very, very important. So, and the reason for that is because they help to expand your network and to expand the knowledge that you have. So if you look at just the strong ties in the social network, there are not that many people, and they all know each other. And so there's not a lot of new ideas coming out of that. So it's only in the weak ties where you get the new ideas. So if you're looking for a new job, then you're probably not going to get a lead from many new leads from your strong ties. You'll probably just get 1 lead or 2 leads, and they're all and everybody knows about the same job opportunity. But you're going to get the big leads from the weak ties. You're going to get new ideas from the weak ties because they have many more tentacles, basically, that they are reaching out to, and so the influences that you get are much broader with the weak ties. So how strong are these social networks, these social norms within these networks? So when it comes to safe sleep for babies, they are extremely strong. So if the norm within your network is to put your baby not on the back, then you are 88% less likely to put your baby on the back. If the norm in your network is to bed share, you are more than 3 times more likely to bed share. And if the norm in your network is to use soft bedding, you are more than 4 times more likely to use soft bedding. So here are some social networks. So each of these little clusters are social networks of mothers that we interviewed. And these are all women who placed their babies on the back last night. The black circles are people in their networks who told the mothers that it was fine to not put the baby on the back, and sometimes encouraged non-back positioning. And the white are people who never encourage the mother to put the baby not on the back. And so you can see there's a smattering of black dots in here. And these are among the mothers who placed their babies on the back last night. And you compare this to social networks of mothers who placed their babies on the sides or stomach last night, and you can see so much more black here. And so these influences are very, very important. We see something similar for breastfeeding. So on the left, you see social networks of mothers who are exclusively breastfeeding their infant. And again, the black are people who in their networks who have breastfed before, and the gray ones, they have not breastfed before. So you can see a lot more black over here on the left than on the right. Okay, so I'm going to shift gears a little bit now to talk about some qualitative work that we've done about trying to understand how mothers make decisions. So the first thing that the mothers do when they have a decision to make is that they crowdsource information. And if you're old like me and you don't know what crowdsourcing is, it means that you basically ask everybody that you know. So here's a quote from a mother. I go with how much to feed a 6-month-old or something like that. I went on Pinterest and they had all these little graph charts of how to feed and when to feed. I have a coworker who has a 1-year-old, so I asked her like what she did. I bounced back to everyone. And then I asked my mom, well, how many times are you all feeding the kids at the daycare? Like that. And then I got my final answer when I went to the doctor this Friday. So it's like kind of, you know, I'll take everything from everywhere. And then this other woman said, I really like gathering information, and the internet's kind of an unlimited way as a source of information. And you can go to lots of sources at one time versus like my mom is one source, and that's limited. So the internet has become a huge resource in terms of crowdsourcing information. So if everybody's telling you the same thing, it's fairly easy to make a decision. So the doctor had gave his advice, and of course I'm going to listen to the doctor, but I did check with my mom too, and then I just kind of asked a couple of sources, like maybe my aunt because she's a nurse as well, just to kind of see if the information is the same. So what this tells us is that consistency is really, really important, because if 99 people tell the mother one thing, but one person tells the mother something else, that one person is going to have just as much influence as those 99 people collectively. So when the sources don't agree, then you have to weigh your choices, and you have to weigh whose decision, whose advice you're gonna take more. It's not always consistent, which I follow for each topic. It just is more what feels good, what makes more sense to me among the different sources, while giving maybe different weights to each one, but still being, this just feels best to me in the end. So ultimately, and the quote from the last mother hinted at this, it comes down to maternal instinct, what the mother feels is right. We all come hardwired with heaven's intuition, and then intuition is somehow amplified for me. I can say once I have my baby, like I can kind of decipher what makes sense to me logically and what doesn't. If somebody says something, sometimes you can just identify in life in general what's for you and what's not for you. And so I think that that's typically my approach when taking or listening to forms of advice. But even after mothers make decisions, they still want to have some reassurance that they've made that right decision. I feel like I have good judgment, so I trust myself for the most part, but then I'm always looking for that like reassurance. So usually I'll turn to whomever, whether it's my sister or the pediatricians, but ultimately I make a decision based on like what I know about my kids. So here's a flow chart of how that kind of summarizes how mothers make decisions. So if they need to make an infant sleep decision, for instance, they crowdsource the information, they weigh the advice with maternal instinct with what feels right. If all the sources agree, most of the time they're going to decide to follow that advice and they'll make that decision. Occasionally they won't follow that advice, but regardless, whatever decision they make, they seek reassurance and positive feedback, and so then it circles back around. Okay, if the sources don't all agree, then there's this additional step of having to weigh all the advice before they make the decision. But again, it has to circle back, and it keeps circling and circling and circling. So the social networks and the norms are important because the social network members are often the first people that the mother will ask. They're often the last people the mother will ask. And there are multiple points at which they can influence behavior. And again, mothers don't want to be judged, so they're most likely to do what they want, what the people in their social network are telling them to do. And I've been talking about mothers. And the reason I spend a lot of time about mothers is because they're actually very different decision-making processes for mothers and fathers. And fathers, not always, but most of the time, they will tell you that the mother is the primary decision maker when it comes to decisions having to do with the child, and the father will do what the mother says. Not always, but since there are differences, and because the mothers are considered the primary decision makers, we've been focusing on the mothers. So now, how do we compete and or work with the social network? So I think it's important that we understand that there are these social networks and there are these social norms. We have to know the evidence behind what we are recommending, and we have to proactively anticipate what questions or concerns the social network has, and therefore the mother or the parents have about what you're recommending. And we have to remember that even though it doesn't sometimes feel like it, that we are trusted sources for the parents. So here's a Gallup poll that's done every year where people are asked who do they trust the most and trust the least. And this is in 2020. And medical professionals do very, very well. So you can see here nurses, medical doctors, pharmacists, and dentists. And so we do very, very well. And then you just for fun, you can just look down here and see who else is who doesn't fare quite as well in people's opinions. So again, we are very trusted sources of safe sleep information, but unfortunately, we often don't give safe sleep information. So when caregivers were asked about what they were told, nearly half of caregivers did not get correct advice on safe sleep practices from their healthcare providers. 25%, about half of them got incorrect advice, and then almost an equal amount got no advice. And when you get no advice, then what parents assume is that this isn't important to do. So if we don't give advice about, let's say, about COVID vaccine, I recently learned that many of my parents had never heard any doctor say anything about COVID vaccine. And so I had several pregnant mothers who had not gotten the COVID vaccine, even though we know that COVID is terrible if you're pregnant. And because none of their obstetricians had said anything about it. And so they assumed that they shouldn't get it. And so I make it a point now to say to every single parent and every single family who comes in that we recommend the vaccine because they need to hear, I want to make sure that they've heard from somebody in the healthcare professions. So again, we come back to this flow chart about making decisions about infant care. And I just want to say that there are multiple points at which we can influence these decisions. So all of these points where they are asking for advice, we can influence those decisions. So the last thing I want to say about the qualitative work is that you only need one champion in the social network. So we found this to be particularly true for breastfeeding. Mothers talked about this a lot, that even if there was nobody in their network who had breastfed before or who supported breastfeeding, that they were able to breastfeed successfully if they had at least one champion. And that champion was often their spouse or their partner. And so here's a mother who actually ended up breastfeeding for more than 1 year. Then I recently found out my husband's side didn't either. They were formula fed. So this was new to both families. It's almost like a culture shock. And I was skeptical about it at first because my boob's a little A cup. So I was like, I'm going to try, but I doubt I'll be successful. But my husband was very, very supportive. Okay, so now I'm going to shift gears again to talk about provide some data about how attitudes and norms can explain a lot of relationships that are out there that we see in the data. So, so one thing that we often see is that higher education leads to healthier practices and better health outcomes. So basically any health outcome or health behavior you can think about, if you're more highly educated, you have better health outcomes or you have healthier practices. And here's just a list of some of them. But why is this? So we did not we, Tim, did mediational and path analyses to explain the processes, explaining the relationship between an independent variable and a dependent variable. So what these mediational and path analyses tell us is this relationship a direct association, or is there some kind of mediator variable in between those two that explains that relationship? So when we do these, it helps us to explain how and why these variables are associated, and then how much each path contributes to the relationship. So here's an example. So, so we proposed a paradigm for the association of education and health behaviors. So what we said was that that if you are that there are 4 different categories of processes that help to mediate the relationship between educational behavior and education and health behavior. So for instance, social factors and networks. So if you are more highly educated, you probably live in better neighborhoods. You have people in your networks are better educated. You're exposed to healthier social norms, larger social networks, race, ethnicity, higher social status, social determinants, systemic racism, decreased stress. All of these things play into this. If you are more highly educated, you have access to a different level of information because you are probably you're higher literate and you have higher income. If you are health literate, you can better follow healthcare recommendations. And if you are more literate and more highly educated, the quality of the relationship with your doctor and the communication that you have with your doctor is going to be different. You're going to have access to more resources. You're going to have better jobs with higher pay, health insurance, access to health care, prenatal care, more nutritious foods, decreased pollutions, safer neighborhoods, better schools, time and place to exercise, things like that. And then finally, cognitive processes are how we take the information in and use that in our lives. So attitudes, perceptions, social norms, a sense of self-efficacy, control, things like that. Those are the cognitive processes. So this is a complicated slide, but I'm going to walk you through this. So this is taking that paradigm and looking at sleep position. So over here is maternal education, and over here is supine placement. And in here, again, you have these social factors and networks, access to information, and cognitive processes. The black lines are positive associations. So the higher the education level, the more likely that is to be. And the thicker the line is, the stronger that association is. So, and then the red lines are negative associations. So the higher the education, the less likely that that factor is. So you can see, and the numbers here are the odds ratios. So you can see here that if you are the strongest, the thickest black lines here in terms of mediating maternal education and supine positioning are the norms and the attitudes. So if you are more highly educated, you're more likely to think that that being on the back is better for babies, and you think that's a good idea, and more people around you are telling you that's a good idea. So those are very, very strong. Okay, so the negative, some of the negative things that are here. So if you are more highly educated, you're less likely to have a non-parental primary caretaker for your child. But you do know that if there's a non-parental caretaker, then you are less likely to use the back position. Okay, so similarly, we did a path analysis with race and breastfeeding because the axiom is that Black women are less likely to breastfeed than white women. But is that true, and why would that be true? So we looked at race and birth country and breastfeeding. So over here, we're looking at foreign-born Black women versus US-born Black women. Okay, and in general, if you are foreign-born and you're Black, you are 7 times more likely to exclusively breastfeed at 2 to 6 months. And you can see here again that these cognitive processes are the most important. So norms, and then attitudes, and then also if you are foreign born, if you're not US born, you are very much more likely to think that you are in control of whether you can breastfeed your baby or not, and that you have the capacity to do that. So when we look at foreign-born Black versus US-born white, you can see it's a little bit more complicated, but again, these positive attitudes, control, norms, these are hugely important, these cognitive processes. And again, if mothers are foreign-born Black, then they really have very, very positive feelings of control and positive attitudes and these positive norms. And indeed, if you are a foreign-born Black woman, you are 3.8 times more likely to breastfeed than a US-born white woman. So, so we use the integrated behavior model to look at how people make these decisions. So, so if you decide, if you use safe sleeping or breastfeeding, first you have to decide to do it, and you have to intend to do it. And then the most proximal things that play into your intention or your decision are, again, your attitudes, your norms, and then personal agency. So this is perceived control, and then self-efficacy. So if I do this, will it make a difference? And then there are all these things that play into this. So your social network, social demographic factors, maternal feelings, maternal behavioral beliefs, others' expectations, others' behaviors, all of these kind of things play into this. So now that we've decided that attitudes and norms are so important, can we change these? And I'm going to talk about a randomized controlled trial that we did that we call SMART, which stands for Social Media and Risk Reduction Training. And this is a 4-armed randomized controlled trial with 2 interventions. There was a nursing quality improvement campaign at 16 hospitals, and hospitals were randomized to either conduct a QI campaign in safe sleep, which was the intervention, or breastfeeding, which was the control. And the goals were to ensure that the mothers heard the key messages and that the nursing staff modeled appropriate care. And then when mothers went home, they were enrolled in a 60-day mobile health or mHealth program where they received frequent emails or text messages that had embedded videos in them. And again, the mothers were randomized to receive either safe sleep or breastfeeding messages. And then they got weekly text message queries about infant care practices. Today's Baby is the brand name of our the mHealth program. So we looked at 4 main outcomes: adherence to 4 different safe sleep practices, supine sleeping, room sharing without bed sharing, no soft bedding use, and pacifier use. And then we looked at the mediators of those outcomes. So we looked at changes in attitudes, perceived norms, and perceived control. So as I mentioned, there were 16 hospitals, and there were 400 women in each group, and they were randomized by hospital. So group 1 got safe sleep nursery QI and breastfeeding mHealth. Group 2 got the opposite. Group 3 got safe sleep, which was our ultimate intervention. And group 4 got breastfeeding, which was our ultimate control group. These are where the hospitals were located. So you could see they were all over the country. So the first thing was to look at whether or not we were able to achieve our campaign goals in the QI campaign for safe sleep. So the blue bars are the baseline before the QI campaign was done. The red bar is at the end of the campaign, and then the green. So that was just one of the videos that we showed. So they're very short and to the point, and again, we hope answered questions and allayed concerns that the parents might have. So we had almost 80% completion rate for our study, and you can see the demographics here. When we looked at the main effects, so this is a safe sleep. So here are the 4 different groups here. This is safe sleep, and you can see here that we had 92% supine sleeping, 86% room sharing, 82% no soft bedding use, and 76% pacifier use. And you can see that these have increased all throughout the groups. And I wanted to say that 92.5% is the highest that anybody in the US has ever gotten in terms of supine sleep position. We were also really excited to see that, that we actually eliminated racial disparities here. So, so if you look here at our breastfeeding control, which is the dark blue bars, and you can see that for all of these that there are disparities here. So, so particularly Black families are less likely to put their babies on their back. And they're more likely to bed share in Hispanic families as well. But then in the safe sleep group, which is a light blue, that these differences pretty much disappeared. So that was really exciting to see. So why was today's baby successful? Again, we did mediational analysis to look at this, and we looked at the behavioral theory variables, the attitudes, the social norms, and the perceived control. Again, going back to the integrated behavioral model. So we first looked at whether or not the mHealth intervention actually made a difference in these mediators. And we found that, yes, indeed, that if they got the mHealth intervention, that they were more likely to have positive attitudes and positive norms about supine sleeping and about room sharing without bed sharing. We didn't see a difference in perceived control, but I think part of it was because so many parents thought that they were in control of the situation. And then we looked at the effects of the mediators on the actual outcomes. And you can see here that the two things that are the largest mediators for whether or not the babies were placed on their back and if they room shared or not bed shared were the attitudes and the social norms. So we were able to change the attitudes and the social norms, and this and those changes in the social norms mediated the changes that in behavior that we saw. So that was very exciting. And when we actually did the causal mediation analysis, this is really complicated. And basically, what you want to see is this. So 63% of the change was mediated by a change in attitudes, and 29% of it was mediated by a change in the social norms. And that was for supine sleeping. And similarly, for room sharing, 33% of it was mediated by attitudes, 10% of it was mediated by social norms. Okay, so finally, what I want to do is talk about how we can put all of this information into practice in terms of public health messaging. So how do we change the norm? So you have to remember that the norm is a perception. It is what people think is the truth. It is not necessarily the truth, okay? So for instance, high school students often have this perception that the norm is drinking. College students as well, that everybody does it. So this is the norm, where in fact, this actually is not the norm. Very, very few high school students drink. So one high school did a campaign before prom season that took advantage of this, and they put posters all up, and they had assemblies and all of this mass information that went out about how 4 out of 5 Panthers do not drink alcohol. Join the crowd. And then you can see here in these little word maps that the things that stand out are unique, achieve, persistent, choices, dependable, and that's what they wanted to emphasize in terms of what the actual norm is. The NIH and the CDC, they collaborate every October during National SIDS Awareness Month and on a hashtag Safe Sleep Snap Challenge. And so what they do is they ask for people to send in photos of babies that are in safe sleep environments. And they usually get tens of thousands of photos. And so what they can then do is they can put these photos up on social media and on other websites and things like that to enhance the perception that this is what everybody is doing. And we know that the majority of babies are sleeping on their back. And so it is that it is a majority, and it is most people are doing it. And this continues to enhance that norm. I don't know how many people have been to Petrified Forest National Park, but they had a problem several years ago that people were stealing the petrified petrified wood. And so, so they put signs up all over the park to try to dissuade people from stealing the wood. And a social scientist decided to study the impact of different types of signs. So they put up 2 different types of signs. One said, your heritage is being vandalized every day by theft losses of petrified wood of 14 tons a year, mostly a small piece at a time. And then another one said, please don't remove the petrified wood from the park in order to preserve the natural state of the petrified forest. So if we were in person, I would take a poll to see which one you thought was more effective. Just the straightforward messaging, or the messaging that explains a little bit more what the reasoning is. So the why behind don't do it. And if we were in person, then I would, when I have done this before, the vast majority of people will choose this one because we don't like to just say things, and we've been taught in medicine that not to just say things, but we have to explain why, because people want to know the reason for it. But indeed, when those signs were up there, there was almost 5 times as much theft. So if you look at the sign itself and see what it says your heritage is being vandalized every day by theft losses of petrified wood of 14 tons a year, mostly a small piece at a time. So what is this saying? You're saying that everybody is doing this, that this is a social norm. So everybody is taking a little piece of wood. And so if you read that, then subconsciously you're going to think, oh, wow, everybody's doing this. If I don't do this, then it's all going to be gone. So I need to get mine. So, so now they've taken down all of these signs, and now they only have these signs. Pepco is the power company in the Washington, D.C. area, and they send out report cards every month with your electric bill. And it tells you how you compare to efficient homes and similar homes. So here is a report card here. So this is your home. You're doing really, really well. And these are efficient homes, and these are similar homes. And what they've done with this, so if you are, if let's say that the colors are reversed, and let's say you are here and everybody else was down here, then you're going to be more motivated to change, because you are not with the norm. So you are going against the norm. And indeed, what they found is that when they started doing those report cards, that they saw an 8.6% increase in efficiency in the people in that category. But then the problem is what's happening with the people that are in this category that are doing really, really well. And indeed, what they found out was that when they first started doing these report cards, that those people felt very, very complacent and felt like they were better than everybody else, and so became a little bit less diligent about saving electricity, and their efficiency went down by almost 6%. So how do you keep this improvement, but without decreasing the efficiency here? And they experimented with a whole lot of different things. And what they finally found was that it was as simple as a smiley face. So, and you're going to think, oh my gosh, that's kind of stupid, isn't it? But this is approval and appreciation that they're doing a good job. And if you, so I was telling one of my colleagues about this, and I said, that's kind of weird, don't you think? And she says, oh no, Rachel, it really works. She's a woman who's my age, and she is taking piano lessons. And she said that one day her piano teacher gave her a little sticker at the top of her piano book because she did a good job. And she said, ever since then, I work so much harder and I practice so much more because I just want that smiley face. So these smiley faces really do make a difference. The other thing that really helps is if you give them small tips for success, because becoming more efficient at electricity is kind of a daunting thing, and it's this huge task and you don't know exactly where to start. But if you have small tips for success, that can help you make a difference. So turn off the lights when you're not needed. You can save up to $35 a year. Improve the shading for your windows. You can save up to $125 per year. So maybe if you just put your window shades down, that's going to help, and turn off the lights when you walk out of the room, then that will help. So when we think about these strategies, do we need to think about how we talk? So here's what I often hear, and I've actually said this in the past, is I understand, and because you're trying to be, you're trying to establish rapport with the parents and empathize with the parents. I understand why you're putting your baby on the stomach, but even though your family and friends may tell you that this is what they're doing, it's not a good idea. And so if you look at it, yes, you're being empathetic, but you're also telling them that that is the norm. And that is what everybody is doing. So you're actually sabotaging yourself. So maybe if you want to take advantage of social norms, you could try something like this. Wow, I'd be interested in knowing why your baby's sleeping on the stomach, because most parents I work with are now sleeping their babies on the back. So I've actually tried this now, and this actually is much more successful. And I do this for vaccines, like flu vaccine. I've done this for a couple of years, and I do think that it makes a difference. And then using the smiley face. So so you can put the smiley face on the ADS, on the after visit summary, or on something to give the parents, or give them a little smiley, bring stickers or stamps to put a smiley face on it, and it really does help. You want to speak out, because again, the norm is what's out there, and the media helps to establish the norm. So when you see commercials or advertisements that demonstrate unsafe sleep, you should speak out. So Charlie's Kids is a safe sleep advocacy organization, and there was an ad, a Keurig ad, that demonstrated an unsafe sleep environment. And so they tweeted at Keurig and said, please stop portraying unsafe. Yes, sometimes it's hard to get babies to sleep, but please stop portraying unsafe sleep in your commercial. And then Keurig actually tweeted back and said, we appreciate your feedback, and we recently revised our TV ad. Many of you will recognize this, this title. It's one of the foremost neonatology textbooks, and the most recent edition originally had this, this photo on it. So, so several neonatologists and safe sleep advocates got together, and they mobilized people internationally, literally internationally, all of the SIDS people, to contact the publisher and to complain about this. Because initially, when one or two people called, the publisher said, no, it's already done, we can't do anything. But then after everybody complained, they did decide that there was something they could do, so they changed this, and for people who had already gotten a hard copy, they sent those people one of those adhesive sheets with the new cover on it that the people could just stick on the old cover. So in conclusion, I hope that you will, I will have convinced you that social networks and norms are powerful forces. They're where parents get their information, where they get their ideas about what they're supposed to do, and that these norms strongly influence attitudes. I hope that I've convinced you that attitudes and norms are important pathways that explain the relationship of other factors like education and infant care practices. I hope that I've showed you that today's baby health intervention achieves success largely by changing attitudes and perceived norms about safe sleep practices. And most importantly, I hope that you will think about how you can use norms to change attitudes and help you sell the message. Because honestly, what we're doing is a sales job every single day with every single patient. And I hope that I've given you some ideas for how to succeed, and I hope that you can give parents tips for success, ideas for how to succeed. I hope you give them positive feedback and encouragement. And most of all, please, please, please use the smiley face. Thank you. And I think that I'm now supposed to do MOC questions. So we have a couple of MOC questions. So question one, according to social norms theory, if most of the mothers whom you know are breastfeeding their babies, then you are more likely to feed your baby formula, breastfeed your baby, or feed your baby both formula and breast milk. And I think we all know that the answer to that is B. You are more likely to do what others around you are doing so that they won't judge or criticize you. Great. Okay, so question two, examples of leveraging social norms to influence parental practice include A, giving parents positive feedback when they say that they're placing their baby supine for sleep, B, stating that the baby will be getting vaccines today rather than asking parents if they would like to have their baby vaccinated today. C, assuring the posters and brochures in your office display the parenting practices that you would like for them to follow. Or D, all of the above.